Hi, my name is Michelle, and I'm a pharmacist. Today, I'm going to talk to you about your naloxone. Naloxone is a medication used to quickly reverse the effects of an opiate overdose. It can rapidly restore normal respiration to a person whose breathing has slowed or stopped as a result of overdosing with heroin or other prescription opiate pain medications. Naloxone is not a controlled substance and cannot be abused. Once you receive your naloxone via naloxone exchange, it is important that you check the expiration date and store it properly to ensure its effectiveness. Keep naloxone in the package you receive it and store it at room temperature away from the sun and bright light. If stored properly, the naloxone should be effective at least until the expiration date on the package, which is typically 12 to 18 months. Monitor the expiration date and replace the naloxone before it expires. When there are no alternatives, expired naloxone may be administered, but may not be as effective. Though naloxone can reverse the effects of an opiate overdose, it is a temporary fix and is only effective for opiate overdoses. Someone who appears to have had an opiate overdose may actually be showing signs of another type of drug overdose or illness. Opiates, when not received by prescription, can sometimes contain other agents that increase and elongate the negative effects of an overdose. In these instances, naloxone may provide temporary relief, but immediate medical care is necessary for the person's survival. Naloxone dose varies dependent on the formulation. It's important to carry at least 2 doses of naloxone in case an extra dose must be administered. Being able to quickly recognize an overdose and acting appropriately could make all the difference. During an overdose, opiates interrupt the body's impulse to breathe, and breathing slows dangerously or stops. Reversing this process quickly is crucial, because without breathing and oxygen, brain damage or death can occur. Some signs of overdose may include skin is pale or clammy to the touch, body is limp, fingernail tips or lips are blue, patient doesn't respond to touch, breathing is very slow or stopped. The first step when you encounter someone who has had an overdose is always to call 911 and then proceed with naloxone. Once you have administered the naloxone, stay with the patient until help arrives. You may also need to administer additional naloxone doses while waiting for medical help to arrive. Many states have Good Samaritan laws that protect individuals who call 911 for help at the scene of an overdose from being arrested for drug possession. Check your state laws. In the case someone has overdosed, here are the 4 steps to administer the naloxone. Step 1. Call 911. Always be sure to call 911 right away, even if the person wakes up. Step 2. Once you have called 911, administer naloxone. Do not insert naloxone into the pre-filled syringe until ready to use. Once inserted, it expires within 2 weeks. First, pull or pry off the yellow caps on the syringe that comes with your naloxone box. Then, pry off the red cap on the naloxone capsule. Then, grip the clear plastic wings on the atomizer and screw on the syringe. Next, gently screw the capsule of naloxone onto the syringe barrel. Insert the white cone into nostril and give a short, vigorous push on the end of the capsule to spray into the nose. Instill 1/2 of the syringe into each nostril. Step 3. If there is no reaction in 2 to 5 minutes, administer the second dose of naloxone. Step 4. Follow the 911 dispatcher's instruction or perform rescue breathing if you feel comfortable doing so. Some side effects of naloxone include anxiety, sweating, nausea and vomiting, or shaking. These are common side effects, but additional side effects may occur and should be examined by a doctor. If you have questions or concerns about naloxone administration or substance use disorder, always speak to a licensed healthcare professional.